Hello, everyone, and welcome back to the Second Global Oncothon's next session. This is, I should be honest, this is one of my favorite sessions, but I see my favorite people here. So, people who are here, they don't need introductions, but let's start with Professor Eric Cooper, who is legendary person who made so many changes in the pediatric oncology field. But he was the former president of SIOP and current board member of UICC and the brain tumor expert. Professor Kaspers, who is the director of academy and outreach of the Princess Maxima Center. Professor Pramesh, who is the director of Ada Memorial Hospital. And lastly, but not least, Britt Marie Frost, who is the head of the Swedish Child Foundation for Children. So welcome everyone to this session. I would like it to be an interactive session, just sharing your perspectives, your experience, how you envision the future of pediatric oncology, what challenges you think we have currently, and how we can overcome that challenges. Let's start with ladies first. So let's give the floor to Britt Marie.
Oh, thank you very much. It's rather exciting to be in this group. I'm honored to be invited, so thank you for that. Yes, I am a pediatric oncologist, and I know a lot of my old friends out in Europe, and one of the faces in front of me at the moment, and and it's very nice. But the last 3 years, I've been working in a different context as head of the research department at the Swedish Child Cancer Fund. And yes, now I'm so nervous. I don't really know what questions you had. I have a lot to say, but what was it you wanted me to put?
Just say what you had in your mind.
Oh, in my mind. Yes. Well, Sweden is very fortunate. We have a robust healthcare system and advanced medical research is going on here. But we still have a lot of challenges. And I would like to speak more globally, but as I work a bit more in a European setting at the moment, I will look at some of the challenges we have. That means that we still have to do more research. I mean, that this is the most important thing, and so that we are going to get into a better situation in the world as a big. But in Sweden, we have one of the highest survival rates in the world, according to SIOP's study, Childhood Cancer Country Profiles. What we don't talk a lot about, and I think we should, is the side effects. I mean, we do in Sweden, we do in Europe, but the side effects is a really big problem. And I think we can do a lot more research-wise in that way. And this is also one of the missions of my work at the moment. And so what I really want to do, and maybe I should not exaggerate the talk because I would like to listen to my friends here, but I want to tell you about some of the works that we are doing in Sweden to get better collaborations in Europe for the research. But I wait a bit and see what the others have to say. So I'm not going to take too much space.
Professor Bouffet.
My turn. So first, thank you for having me today, and I know that you had a busy day, Shushan. We were together yesterday in Cyprus. I'm back in Paris right now. I spent the night in a plane. But the topic we had in Cyprus was about global oncology, and it's always this crucifying contradiction, which is the 80-20. So 20% of the children have 80% survival, and 80% of the children in the world have 20% survival. Every year, there are 400,000 kids who are developing cancer, and I will not use the term diagnosed, because half of the children don't even make it to the diagnosis. They may make it to the door of a hospital, that they were turned away, they are turned away because they have no money, or they live too far away, or the hospital doesn't have the resource to treat them. And in this work where two worlds collide, where you have so rich countries and so poor countries, I think it's our role to advocate and to say that this is not acceptable anymore. Now, as a physician, I'm stretched between these two worlds because I had the privilege to lead the pediatric brain tumor program in Toronto for 22 years, to be part of new drug development, to do clinical trial, and to do exciting things and research. Dr. Uri Tabori is now the director, and we still work together on, very, very stimulating research, CMMRD, which is a condition related to the consanguinity and the cancer in children, for example. And on the other side, I'm working with 32 different countries as a pediatric oncologist to support the development of a pediatric neuro-oncology program. So many people say, brain tumor is not a priority because it's too complicated. But brain tumor is 20 to 25% of all cancer in kids. So if you say this is not a priority, what is a priority? I remember 30 years ago, people used to say, cancer in children is not a priority. There are other priority, which is infection or HIV or issue like this. But, when a child is sick, when a child has a life-threatening disease, this is a family who is devastated. And whether the child lives in a high-income country or a low-income country, the consequences on the family, on the sibling, on the parents, on the grandparents, on the friends is the same. And we cannot ignore this. So my message today is, let's do this word a better word. I know that there is a GICC, the Global Initiative for Childhood Cancer, that is going on, but it doesn't mean that we should wait and see what Sanjud and the WHO is doing. Everybody has a responsibility in this initiative, and as little we can do, let's do it, and we will make this world a better world. Thank you.
Wonderful. Thank you so much for sharing that. Now let's give the floor to Professor Kaspers. At the end, of course, we will have a discussion.
Yes, also for me, it's a privilege to join these discussions and these 24 hours. All the best with that, by the way. Yeah, so I guess for me, the biggest problem is if you really want to achieve higher cure rates of children with cancer, it's to get more children into that treatment. And indeed, there's countries where much more than half of the children are not diagnosed and treated. So I guess we do need advocacy. We do need pressure on governments, organizations. At the same time, I really hope that we get more pediatric oncology centers involved in a collaboration with hospitals in resource-limited settings. And of course, I'm glad to work in a relatively big institute, the Princess Maxima Center. We have more than 60 consultants. So we do have some people available that can in partnership with hospitals in Sub-Saharan Africa, Indonesia, but also now closer to our home in Eurasia and East Europe. But we need many more hospitals in the let's say high income countries to become involved. I tried that once within a leukemia and lymphoma sort of society, the International BFM Study Group. To be honest, at that time, that's more or less failed. So I guess today I want to ask all my colleagues in privileged settings to start collaborating with our colleagues in resource-limited settings. And there's many actually that are very motivated and that they want to diagnose and treat more children, try to cure them. And I guess we can help. So together we can make things improve. That's what I am hoping at the moment.
Yeah, that's so true. Earlier today in the session, we were discussing that even if low limited resource settings don't have the infrastructure or maybe don't have the funding or some other things, but they have the team, they have the great minds, so and also the enthusiasm to make the change. And I think the team is the most important thing. If you have the people who are going to implement the idea, then they will be the real change makers. So I would like to, we are all ears to hear what Professor Pramesh will say from his perspective as he's a surgical oncologist as well.
Thank you. And let me take this opportunity to thank OncoDaily and the phenomenal team behind OncoDaily, Jawad, Shushan, Amalya, and many others who I know have been working behind the scenes. It's incredible the work that you're doing, and to bring the concept of control of pediatric cancers up in the forefront on the International Childhood Cancer Day. And hats off to you for everything to be that you are. And I can't express how much a privilege it is to be part of this panel with such eminent co-panelists on this. As all of us know, and I'm probably preaching to the converted here, children's cancers are probably an exemplar for what all of us in adult cancer control should be learning from. The fact that if you work collaboratively, if you work as a team, you can actually create a lot more impact than you would as individual centers or individuals working on this. And the success of the cooperative oncology groups in pediatrics is probably something that many of us in the adult cancer world can learn from and emulate. I think I agree predominantly with what Eric mentioned about how cancer death is the same, whether it's in a low middle income country or a high income country. But the challenges are very different. And it's important to acknowledge that these challenges exist. And if we were to look at equity as a fundamental principle of what humanity is all about, I think we should work much more towards creating equity than just looking at those fancy new tools that we see in cancer control, at least in the adult cancer world that we see in. And within the Tata Memorial Hospital in Mumbai, as well as the National Cancer Grid, we are committed towards equity. And that's something that we work hard towards, creating a sense of uniform standards of care and to develop human resource to be able to tackle the increasing burden of cancer in many parts of the world. And often what we see as research that occurs in high-income countries is predominantly not applicable in low and middle-income countries. And it's up to us to make sure that the research that we do in cancer in general and pediatric cancer in particular is fit for purpose in these locations globally. The St. Jude and WHO initiative of the Global Cancer Initiative on childhood cancer is welcome. And I hope, even given the current changes in the US administration, that continues to be well-resourced. And again, this can be an exemplar of how adult cancers can learn from pediatric cancer control in how we can reduce the overall burden, including the morbidity and mortality of pediatric cancers globally. I must say, and I don't want to be political here, that given the current situation in the US and in other parts of the world, where we have been sidelined into an aspect of wealth over health, it's time for us to get control over the situation. All like-minded individuals getting together, ensuring that we are working towards a common goal of global cancer control, global health care. And this could actually be an opportunity rather than a threat if the rest of the world, including Canada, Europe, Latin America, Asia, Africa, were to get together and work towards a common goal of universal healthcare. And especially when it comes to cancer control,
this could well be used as an opportunity rather than a threat. Thank you.
Thank you so much. That's so true. I completely agree. Britt Marie, you wanted to say something? Yeah.
Yes, I agree. I mean, it's the problem is so big and it's so global. So is it worthwhile doing these fancy medicines and so on that we are developing here? I believe it is. I think that we are really, things are really happening that's going to be globally useful in the future. But of course, we still have to develop the new medicines, and we have to develop, like what I like to talk a little bit about it, the whole genome sequencing, which is very expensive today, but it's very, very useful in the future, I think, for a lot more than just the rich countries. And so I think it's important that we in Europe, the Dutch people together with the Swedish people and the French people and the English people, we can develop things that are going to be helpful in the key of getting treatment to much more people around the world. And I'm not going to go into details with that, but in Sweden, we today do whole genome sequences on all the children. And it's done in some other countries too, but this is done in a very sort of big, so everybody's included. And this is important that we work together with other countries. So I just want to put a bit more emphasis on that part of this, because now we are talking together and to really work hard on the development of the not only treatment, but also diagnostics that we then can use globally. I think it's. I think we are going to get. I'm very hopeful. I wasn't so hopeful some years ago, but maybe it's the old age. But I'm hopeful for the future. Although the political situation today and what we are facing today is just it's a mere dream, of course. But we have to go on with our little world and try to do the best of it. And well, I think I'll leave it at that at the moment. But yes, collaboration together. That's the cue, and we're reaching out our hand. We want to be part of it.
Yeah, wonderful. Thank you so much. So I have one hypothetical question for everyone. If you were a magician and you could change one thing in pediatric oncology to have the improvement in the future, and just with one click, what would be that? I would like to have your opinions.
One tool.
Yes.
Okay. Maybe I'll try to be a magician. One tool. Okay, so I think many colleagues working in the field, healthcare workers at a very basic level, are not really aware of childhood cancer. So I would, and knowing that the majority of children don't get a diagnosis, so I would work on a tool, an app where they put in complaints, the age of the child, some findings, simple findings of a simple physical investigation, and then that an alarm goes off, this might be childhood cancer, refer the child to the appropriate hospital. I would work on that.
Well, great idea. What about others? Professor Bouffet, what do you think?
So one tool, I was tempted just to mention targeted treatment because they are oral medication and they can save lives when kids live so far away from the hospital. But in fact, one tool I wish, I dream, and I pray for is called UHC, Universal Health Coverage, to make sure that no child is turned away because the family cannot afford the cost of the treatment. And we need to really define together what is a universal health coverage and to make sure that it addresses all the needs, not only of children, but also of adults who are suffering from conditions where there is a difference between countries. And when this is put in place, there is this song, last night I had a dream, and that's my dream. It's just when this is put in place, everybody will dance on the same music.
That's so inspiring. Thank you so much. Britt Marie, what do you think?
Oh, this is really hard, but I also think of the targeting treatment, but that's then you already have to some magicians has to come before me and make magic in a better world, because it's about the world. I think we can make magic in a small sense, but as it looks today, it's a different thing. But I believe that we are really on the urge of kind of finding the keys what cancer is. So I think the magic is around the corner, but that doesn't mean that it's going to save all the lives that it should be saving all around the world, that we should have 85% survival all around the world. But when it comes to solving the key of treating cancer, or maybe finding cancer before it starts, I think we are there. I think we're almost there. But maybe I'm just being stupid, but that's the way I think. And hopefully we will get there. But then you have the other problem, and that's the crazy world we live in. And I wouldn't, if I had that magic, I would really use it.
Wonderful. Let's see what Professor Pramesh thinks.
Shushan, abracadabra. But seriously, it's better health systems and access. If you look at and pediatric cancers are not in isolation on this respect. It's universal for all types of cancers, but especially for pediatric cancers where the cure rates are so high, this is so tragic, because the majority of pediatric cancers just don't get diagnosed. To me, it's far more upstream of diagnosis, staging, treatment, survivorship. The majority of children with cancer just don't get diagnosed. And to me, in the low and middle income world, that's a problem that we need to solve, the problem of access. And I think Eric alluded to this when he mentioned about universal healthcare. What we mean by universal healthcare is not just about everyone who gets diagnosed getting the best treatment, but even ensuring that every child, every adult, every person with cancer actually gets access to the best possible cancer care, diagnosis, staging, and treatment as they can get. To me, it's a question of access and improving the existing healthcare systems that we currently have in the world, and to all governments across the world. And I don't mean this derogatively. I think we need to improve and increase public and government expenditure on healthcare. I can take the example of India, where the overall public healthcare expenditure is 1.5% of GDP. That's ridiculous, considering the fact that our GDP is $2,000, non-adjusted for purchasing power parity. And even if you had to adjust for purchasing power parity, it's about $8,000 or $9,000. So unless we increase public and government expenditure on healthcare, improve the concept of universal healthcare, and promote access and affordability of healthcare, we're not going to get anywhere. And I think this is one message that I want to really convey very strongly to the world's governments.
Yeah, that's wonderful. Thank you so much. And I just want to add that apart from my hypothetical question, you are already magicians, all of you, because you have done so many things in the field and you improved so many, you helped so many children to live their lives. So I can consider you all as a magicians. Thank you so much for being with us today. And I just want to wrap up the session. It's 11 and a half hours that we are online. And before, early in the morning, Her Royal Highness Princess Dina Mired started the Oncothon. She challenged her 3 friends. So she donated $10 and challenged 3 friends to donate $10. But with the condition that the other 3 friends are going to donate, and again to build the chain, so that we can have the viral chain going for donation. So I would like to remind everyone that we have that option. And again, thank you so much. It was an honor for me to be with you in this session. Happy to see you online and hopefully soon in person as well. Thank you so much.